Hi, I'm Coach Amber, and welcome to the Meet Our X success story. And today we have a special guest, Dr. Al. How are you today, Dr. Al?
I am great. Thank you. It is beautiful where I am here in Charleston, South Carolina.
Awesome, awesome. We kind of have it overcast and cloudy here in Central Texas. So,
But it's
okay,
beautiful and
so
sunny.
uh, normally you would think so, but here this past week it's been kind of crazy. Okay, so if you can kind of give us an idea of what was going on prior to you starting the carnivore diet, like what was going on in your life, how is your health and etc.
Definitely. So, actually, 2 years before I started the carnivore diet, I have a story, and it really begins in April 2018 when I was really feeling pretty healthy. I was writing and lecturing and consulting about primal or ancestral diets, active lifestyle, and how it affected the mouth because I'm a periodontist, as well as the overall health and affecting chronic diseases. So I was actually traveling from Charleston to Austin, Texas. I was speaking at Paleo FX, as a matter of fact, in April 2018. And generally, I carry my bags. And when I go to the Atlanta airport, because I always have to make a connection in Atlanta from Charleston, I go from concourse to concourse. And I have enough time, I like to walk. So I put my bag on my right shoulder. I started to walk, and I walked continuously until I got to my connection, and I noticed that my right shoulder was really getting sore, which never happened. So um, I went to the meeting, I did my talk, I left the meeting, came back to Charleston, and the soreness never seemed to go away. And it stayed in my right shoulder, and then it seemed to go back into my back area, and then it left my back and went into my chest area, and it just didn't seem to heal. It just seemed to move around. So by August of 2018, I went to my physician, and I said, something's going on. My shoulder is just getting sore. My chest is sore. What's going on? So he did some blood work. Nothing was abnormal except a blood test called CRP, C-reactive protein, which identifies some kind of systemic inflammation. He then wanted to do an MRI, which I obviously had done, to see what might be going on. And once the MRI came back, it turned out that he felt I had one of three things: lymphoma, leukemia, or multiple myeloma. Mind you, I'm thinking I'm a pretty healthy guy with maybe a rotator cuff, and here I am given almost a death sentence. So um, rather shocking. He brings on an oncologist. The oncologist orders a PET scan, which is a very specific bone scan to look for cancer cells. There was a mass on the side of my spine. They did a biopsy. They did a bunch of other cancer blood tests to see what was going on. And then my wife and I, my adult kids, were in my oncologist's office to hear the diagnosis and prognosis. And it turns out that I have a disease called IgA kappa light chain multiple myeloma, with innumerable lytic lesions of my skeleton, meaning holes throughout my body and my bones. And it's rather aggressive. And my oncologist gave me 3 to 6 months to live at that point. I could have been dead by December 2018. My options were to immediately start chemotherapy, and the chemotherapy would maybe put me in remission, but after a time, the cancer would come back, and I'd go back and forth from different chemos until eventually all the drugs wouldn't work. The cancer would eventually cause me to die because it's incurable. I didn't like that idea. It would decrease the quality of my life. That was the only thing that really was important to me. So I investigated a bunch of alternative, unconventional type of cancer protocols, which I got involved with and started with. And things went well for a while. One of the problems that I had were the holes in my bone, making my bone very fragile. Didn't realize it. I knew it, but I didn't really know what that meant until I actually was in my bathroom sometime in August of 2019, and I turned and twisted and I collapsed. I split my femur in half, my right humerus in half, broke a couple ribs, and I was in terrible shape. Even previous to that, I had other pathological fractures, but nothing as severe as this occurrence in my bathroom. And I felt I was going to die. And when I went to the hospital, they fixed my leg. I really was not interested in living anymore because I knew it was the end. And I went into hospice, and I was ready to die. Interestingly, there was a hurricane that was coming to Charleston at that time, and the hospice had to evacuate the hospital, and they caused me to be transported to my home. My wife, who is a nurse, actually had to get a hospital bed immediately, and I was in this hospital bed for another several weeks in my house, still in hospice, waiting to die. And actually, I rallied. And I not only rallied, my wife pushed me to the point where I rallied significantly. We got a physical therapist in the house. He helped me. I got back onto my protocols to heal my body. Within a few weeks, I was really doing exceptionally well. And a very long story making it shorter, I progressed and continued with my oncologist and on my unconventional protocols. He eventually put me on some very unique, newly developed immunotherapy drugs just to maybe kill specifically cancer cells. It wasn't chemotherapy. And along with my unconventional protocols, I did very well. So 2 weeks ago, he decided that he needed to see what was going on in my body, so he did another PET scan. So the two PET scans that I had done previously, one around my diagnosis and one in the middle of my journey, showed lots and lots of cancer cells. So this new PET scan actually showed no cancer cells in my entire body. So I just found this out 2 weeks ago, and it's like amazing. So prior to that, in January of 2020, January 1st of 2020, I changed my diet from paleo, which is what I was doing for the last 6 or 7 years, to a carnivore diet. And I did that for a variety of reasons that we can get into, but that, as well as my other protocols, I believe, have participated in me being hopefully cancer-free. Now, there are other factors involved that I still need to get straight with my blood chemistries, specific blood cancer chemistries, but the fact that there are no active, in other words, thriving cancer cells in my entire body, and this PET scan was from head to toe, is amazing. So I'm a walking miracle from hospice to where I am today, basically from death's door to where I am.
I can't even imagine being told that basically you're done. And then to be able to just come back from that, that is like one of the most amazing stories I've heard yet. I'm so glad you didn't give up. Just out of curiosity, do you think you would still be here today if you didn't do what you did?
No, no. I think that if I didn't do what I did with none of my protocols, I did the chemotherapy, I did the things that would have decreased the quality of my life. My prognosis was poor, and if I were still alive today, I would be debilitated. And that would have been the worst thing in my life. I have no problem with dying. You know, longevity is not a problem for me. If I am going to die, okay, I'm going to die. I was never in denial. What the most critical thing was that I wanted to live whatever time I had with a quality of life. And the chemotherapy, although some people do well, the chemotherapy I've seen in people become destructive. You know, some of the side effects of chemotherapy are called side effects. I know those side effects could be worse than the cancer. If you get what's called oral mucositis, which are really severe sores in your mouth. You can't talk, you can't swallow, you can't eat. That is considered, oh, a side effect of chemotherapy and radiation. Well, that's terrible. And it may not go away. And if it goes away, it could take a long time to go away. That quality of life just didn't sit comfortably for me. I just didn't want to experience that.
I could not agree with you more. Quality of life is everything. It's not the longevity, it's the quality of life. So I am so glad that you did what you did. Just real quick before we get to the next question, how old are you?
I'm 73.
I think this is really important for
Yeah,
everybody
it
to
is
know.
important because I only was diagnosed at the age of 71. I think that my cancer is related to my years in dental school in the early 1970s. So what's very important for anybody to understand is that cancer doesn't start and manifest immediately. Everybody has cancer cells in their body, everybody. But everybody's cancer cells go through a process of self-destruction. Your cancer cells know they're cancerous, and there are mechanisms within the cell or in the immune system, if necessary, to kill that cell. But I think that my exposures to low-dose radiation on a regular basis, which are dental x-rays, for 6 continuous years in dental school, and my exposure to free mercury, which is something we used when we did silver fillings or mercury fillings in teeth. We played with free mercury like kids play with Play-Doh today in their hands, penetrated my tissues, got into my mucous membranes. One cell in my body, I believe, one plasma cell was damaged to the point it never died, and it started to replicate. And it took 40 some years to get to the point where it manifested and overwhelmed my own immune system to, in 1970, I mean, in 2018, to manifest to the diagnosis of my severe multiple myeloma.
That's crazy. Okay, so can you tell us, when you started Carnivore, how did you implement the diet? Like, what
Sure.
did you eat? What did you include? What did you not include? And maybe why?
So I started the carnivore diet for a very specific reason, to help treat and maybe cure my cancer. Because there are some published case studies, especially in Budapest, Hungary, from the Paleomedicina Clinic, that a very strict carnivore diet, which they call a Paleolithic ketogenic diet, can actually create ketosis in the body to starve cancer cells, repair the gut epithelial barrier, and cure cancer and many other chronic diseases. So that was my rationale to start the diet. I didn't have to lose weight, but I have lost some weight. Interestingly, I have lost fat, but no muscle mass, which is great with a carnivore diet. And it's given me all the nutrients my body needs, as you know, so I don't have to go into the detail about that. And it's eliminating the plants that are potentially irritating to my gut epithelial barrier, which is so critical if I want to try to cure or at least resolve this cancer. So I was on the diet with a high fat content. My fat to protein ratio is 2 to 1 in grams. So 2 grams of fat to 1 gram of protein. And I am concentrating on not muscle meat, as you know. I'm concentrating on some muscle meat, but a lot of organs and fat and gelatinous material from pastured grass-fed cattle, as well as wild-caught fish. I don't do dairy because casein in dairy does damage the gut lining, just like gluten does from wheat and rye and barley. So it's important for me to eliminate what would be called anti-nutrients that are in plant foods. So I love the carnivore diet, so it's just devoid of the plant foods with all the nutrition my body needs and the high fat content to put me in ketosis for the majority of the time. I'm not in ketosis all the time. I check my ketosis on a regular basis. I am in ketosis sometimes, not in ketosis other times, but I'm okay with that. So that's how I implemented it. And what's beautiful about the carnivore diet is it's so simple to shop, right? You go into a grocery store, a healthy grocery store, you're out in 5 minutes because the only foods that you're looking for is where the meats are, and that's it. You look at the meats and you walk out, you know, so it's very easy. I do eat eggs. Um, I eat a variety of extra fats that I put into my foods. I do drink coffee in the morning. I use heavy cream, which is not really much of a dairy because it doesn't have the protein of dairy or the carbs. It's just basically the fat. So I put a little bit of heavy cream. I use some collagen peptides to give me that other component of proteins, which I love. So I do that in the morning. And I do have maybe some raw honey, Manuka honey, maybe 1 or 2 teaspoons a day. There are some significant biological benefits to that. You're only adding 6 grams of carbs when you have a teaspoon of raw honey, so it's not going to throw me out of ketosis. And I know it doesn't because I still stay in ketosis when I test myself, even though if I eat, I do it every day, but for the most part I do, and I like it.
That's awesome. Did you have any transitional issues when you started carnivore?
You know, everybody does when they go from a standard American diet to this very, very strict carnivore diet. There's so many issues that happen. But I was on a paleo diet for 7 years. So when I was strictly carbs, like a standard American diet, way, way back when I was 65 or so years old, that's a long time ago since I'm 73, by the way, so, which I already told you and you know. So when I started a paleo diet, I went through the flu symptoms, the achiness, the severe cravings of carbs. You know, I was at a point where I just needed a a junky burger or something because I just needed those carbs and junk. But once 2 or 3 weeks go by, those cravings go away. And although those sandwiches may still smell good, I don't have a craving to eat them. So I really had no problems. There were maybe some bowel movement issues for 2 or 3 days, but nothing severe. I have very regular bowel movements with the carnivore diet. You know, one of the big complaints that I've heard from physicians that have said you're totally wrong doing a carnivore diet because you're not getting any fiber and you need the fiber for to have healthy bowel movements. You need the fiber to create short chain fatty acids in the gut. Well, both of those statements are incorrect. Number one, the fiber isn't critical for the gut motility that creates healthy bowel movements, which is fascinating. The other thing is fiber is not necessary for the gut microbiome to create its essential short chain fatty acids. As a matter of fact, a paper was published less than a year ago that showed the different microbiome in the gut, the different microbiota in the gut actually ferments amino acids to create the same short chain fatty acids that they create from fiber. So your microbiome in the gut is very amenable to change. And there was another study done a couple years ago that showed when you look at the microbiome in the gut on a plant-based diet, and then you switch to an animal-based diet, the microbiome in the gut absolutely changes, but it changes rapidly within 24 hours. And then you go back and forth from a plant diet to an animal-based diet, that microbiome continues to change, but still stays efficient. It's amazing. So the fiber is not a critical element. And you can get fiber, obviously, from eating meat. You're chewing cartilage. There's some fiber in there. You might be eating, like I eat sardines with bones and skin on. There's fiber in that that actually works, at least like fiber would work. So it's not a factor, but I have not had any other issues starting the carnivore diet. I love it.
That's great. That's great. And I so agree with the whole simplicity of it. That is the best part. I love that. Okay, so you hit a little bit on how the carnivore diet has helped in within some of your other protocols. Do you want to elaborate a little bit more and kind of give us an idea what your quality of life is like now?
Absolutely. My quality of life is amazing. So, you know, I've had so many pathological fractures it would blow your mind, but I have a broken arm that never was set. So it looks almost like I have an extra elbow in my biceps. That's because the bone is at an angle and it healed by callus formation. I have a right femur that was completely fractured in half and then repaired. I have a bar in my right leg. I have a left femur that was partially damaged, but not fractured in half. I have a bar in that leg. I have a couple vertebral vertebra that were fractured. I have some ribs that were fractured way back then. I had a hairline crack in my pelvis. So how do? I do really well. I walk outside about a mile every other day now. I do modified push-ups. I do modified squats. I get around and I feel good. I have some limited mobility on my right arm because of the fracture, but for the most part, I'm okay. I can ride in a car, but not for many, many miles. It gets uncomfortable. I can't fly at all, so I don't fly airplanes anymore. That's not bad either, but I don't do that. Um, Other than that, I'm pretty normal. When you look at me, I don't look like I'm breaking down. When I go to the cancer clinic, which I do on a regular basis, and I look at all these other cancer patients, it's pathetic. Actually, it's pathetic. So my lifestyle and quality of life are great. I attribute it to my integrated protocols, and I'll just go over them with you a little bit. For the most part, and most significantly, is my diet, because it's critical as to what I put into my body, and even more important, what I eliminate or avoid that gets into my body. And the carnivore diet is a huge factor in that. The fact that I have eliminated plants, which is significant, means that I have eliminated potentially significantly damaging anti-nutrients like lectins and phytates, and especially oxalates, that will damage my gut barrier, which is so important for me to maintain in a healthy state. The other thing, the second most important thing, and probably goes hand in hand with the diet, is to maintain this gut microbiome in a very healthy state. So to do that, I use spore-based probiotics, which are the only probiotics that grow in the intestines, as well as create metabolites that are beneficial to all the bacteria, and creates an abundance of other commensal bacteria in quantity and quality. And I need to support the mucus layer, which blinds the epithelial barrier in the gut, as well as maintain that epithelial barrier so it doesn't create little holes and leak junk into my bloodstream. So that is my second most important protocol. Then I have a variety of herbal extracts that I use that enhances my immune system. Certainly the diet and the gut go way far in making my immune system efficient and effective, but some herbals, and I use astragalus, echinacea, and Korean ginseng to help with my adaptive and innate immune system. After that, I do some things that improve my metabolism. I do some exercises like I explained to you. I do what I think is very critical. I use pulse electromagnetic field therapy. This is a method of producing low frequency electromagnetic fields that are similar to the Earth's electromagnetic field, generated by a mat that uses copper coils, nothing that is unhealthy or metal other than the copper. And it creates a type of frequency and vibration that actually heals dysfunctional mitochondria by improving the calcium channeling, as well as the millivoltage between, or from the inside to the outside of cells, and improves the AT production in the electrotransport chain from protein complexes 1, 2, 3, and 4. That's kind of getting too techy, but it improves the mitochondria. And what's critical about that with my cancer protocol is that cancer is a disease of metabolic dysfunction. That's where the diet comes in and the microbiome comes in, and mitochondrial dysfunction. Metabolic being the diet, and mitochondrial, which is the powerhouse, the batteries of every cell. So when pulse electromagnetic field therapy can improve the mitochondria, it improves one of the critical elements that causes not only cancer, but any and every chronic disease. So I use that on a regular basis, 3 to 4 times a day. And those are, for the most part, my strict protocols.
Thank you so much for sharing your story. I think that people who are in your situation, based on the story, it will give them hope. And I think that is a huge, huge thing. So I greatly appreciate you coming on the show.
I will say one more thing.
Yes.
If you have a life-threatening health issue like I have had, don't rely on one physician's opinion and that's it, and they tell you you must do this or else. Okay, accept that, but get other opinions. And if you ask questions and your healthcare professional doesn't want to give you answers or poo-poos what you're asking, just fire that person and go to another one. Because it is so important to understand there are many ways to treat diseases today. Some of them are unknown. Some of them are not in mainstream medicine yet. And so you need to do some research, but there is a path that you can follow, and you need to find a practitioner who not only understands your concerns, but is empathetic. And reducing your stress levels because of this disease you have go a long way in healing your gut. And this is not anecdotal, this is scientifically proven. So stress is a huge factor that needs to be reduced. And when you go into a medical professional with fears and anxiety, and they treat you like another piece of dirt that they're playing with, that's not going to support your emotional status. Find another practitioner that will help you.
Great advice. Really, really great advice. I just went through cancer with my mother. So I
Sure.
totally
You know
get
this.
the importance of that. I do. I saw it firsthand, so I do. Thank you so much for joining us. I really do appreciate it. And y'all be sure to go check out the interview Dr. Sean Baker did with Dr. Al Danenberg. I forgot to say your last name in the beginning. I'm so sorry. But anyway, y'all check out that interview with Sean. He goes into much more depth. Super great information. I'm really happy that I got to watch that before starting this. So anyway, well, thank you again for joining us. And
Thank you so
have
much
a
for the
wonderful
opportunity.
day.
I love it.
You
Thanks.
bet. Bye.